Penguin Random House Audio presents When Panic Attacks, the new drug-free anxiety therapy that can change your life, by David D. Burns, M.D. Read for you by Kaleo Griffith. Publisher's note: this audiobook includes visual references and graphs, which can be viewed by opening the accompanying PDF file on any Mac or PC computer. Author's note: the ideas and techniques in this audiobook are not intended as a substitute for consultation or treatment with a qualified mental health professional. The names and identities of the people in this audiobook have been disguised to such an extensive degree that any resemblance to any person, living or dead, is purely coincidental. Most of the cases represent composites of many patients with similar problems. I've done this to protect patient confidentiality. However, I've also attempted to preserve the spirit of the work we did together. I hope these stories ring true and resonate with your own personal experience. Introduction. Do self-help books actually help anyone? During the past 15 years, Dr. Forrest Scoggin and his colleagues from the University of Alabama Medical Center have conducted a series of innovative experiments designed to answer this question. The researchers randomly divided 60 patients seeking treatment for episodes of major depression into two groups. It told both groups of patients that they'd have to wait 4 weeks to see a psychiatrist. In the meantime, they gave each patient in one group a copy of my first book, Feeling Good, the New Mood Therapy, and encouraged them to read it during the waiting period. The patients in the second group did not receive the book. A research assistant called all the patients each week and administered two widely used tests that can track changes in depression. The researchers were surprised by the results of their study. At the end of the 4-week waiting period, 2/3 of the patients who read Feeling Good had improved substantially or recovered, even though they did not receive any medications or psychotherapy. In fact, they improved so much that they didn't need any additional treatment. In contrast, the patients who did not receive Feeling Good failed to improve. The researchers then gave them a copy of Feeling Good and asked them to read it during a second 4-week waiting period. 2/3 of them recovered and did not require any additional treatment. Furthermore, the patients who responded to Feeling Good have not relapsed, but have maintained their gains for up to 3 years so far. These were not fly-by-night studies, but peer-refereed studies published in top psychological and medical journals. The researchers concluded that Feeling Good bibliotherapy should be the first line of treatment for most patients suffering from depression because it often works faster than drugs or psychotherapy. In addition, it's incredibly cost-effective and entirely free of the troublesome side effects of psychiatric medications, such as weight gain, insomnia, sexual difficulties, or addiction. The therapy I described in Feeling Good is called cognitive behavior therapy, CBT, because you learn to change the negative thoughts or cognitions that cause the depression, as well as the self-defeating behavior patterns that keep you stuck. Dr. Scoggin's groundbreaking studies clearly show that for many individuals, CBT can be very effective in a self-help format, even without pills or the guidance of a therapist. Dozens of published studies have confirmed that CBT is also effective when administered by therapists. It's at least as good as the best antidepressant medications in the short term and is more effective in the long term. For example, in a recent landmark study conducted at outpatient clinics at the University of Pennsylvania and Vanderbilt University, 240 patients suffering from episodes of moderate to severe depression were randomly assigned to treatment with CBT, paroxetine, Paxil, or a placebo so the effects of these treatments could be compared in both the short and the long term. The results were recently published in 2 major papers in the Archives of General Psychiatry, the top psychiatric journal. The findings confirmed, once again, that CBT was at least as effective as the antidepressant in the short term, but more effective in the long term. Dr. Robert DeRubis, the chairman of the Department of Psychology at the University of Pennsylvania, explained that CBT had more lasting effects because it gave the patients the tools they needed to manage their problems and emotions. He concluded that CBT, and not pills, should be the treatment of choice for patients suffering from moderate to severe depression. He stated, "Patients with depression are often overwhelmed by other factors in their life that pills simply cannot solve. Cognitive therapy succeeds because it teaches the skills that help people cope." CBT has also been shown to be effective in the treatment of anxiety. In fact, in the Review of the World Literature, Dr. Henny Westra from York University in Toronto, Ontario, and Dr. Sherry Stewart from Dalhousie University in Halifax, Nova Scotia, concluded that CBT is the gold standard in the treatment of all forms of anxiety. CBT is more effective than any other type of psychotherapy or medication. In fact, CBT without medications appears to be more effective than CBT with medications. My own clinical experience is consistent with these conclusions. But here's the question. Will CBT bibliotherapy be effective for anxiety? If you're suffering from shyness, chronic worrying, panic attacks, phobias, public speaking anxiety, test anxiety, post-traumatic stress disorder, or obsessive-compulsive disorder, will this audiobook do you any good? Some encouraging studies suggest that the answer may be yes. Dr. Isaac Marks from the Institute of Psychiatry at the University of London has shown that many individuals can overcome anxiety disorders using CBT techniques without face-to-face psychotherapy or medications. I'm hopeful that this book will prove just as effective for people with anxiety as Feeling Good has been for people struggling with depression. However, no book, technique, or pill will work for everyone. Some people will need the help of a compassionate and skillful therapist in addition to the methods in this audiobook. There's no shame in that. When should you seek treatment from a mental health professional? There's no absolute rule, but these guidelines may help. How severe is the problem? If you feel overwhelmed or hopeless, face-to-face therapy can be extremely helpful. Do you have any suicidal impulses? If you have the urge to take your life, you should never rely on self-help alone. Emergency face-to-face intervention is mandatory. If you have a therapist, call him or her immediately and describe how you feel. If you have no therapist, call 911 or go to the emergency room of the nearest hospital. Your life is too precious to play Russian roulette. Do you have any homicidal impulses? If you feel enraged and have the urge to hurt or kill other people, emergency intervention is mandatory. Don't flirt with these urges. What type of problem do you have? Some problems are harder to treat than others, and sometimes medications are indicated. For example, if you have bipolar manic-depressive illness with extreme, uncontrollable highs and lows, then mood-stabilizing medications such as lithium may be necessary. How long have you been suffering? If you've been working with the tools in this audiobook for 3 or 4 weeks, but your symptoms haven't started to improve, then professional guidance could help you get on track. It's the same as with anything you're trying to learn. If your tennis serve is off, you may have trouble correcting the problem on your own because you can't quite see what you're doing wrong. But a good coach can quickly diagnose the problem and show you how to correct it. I think it's great news that so many people suffering from depression.
Sample complete. Ready to continue?